Welcome to my talk about the many wonderful aspects of a career in veterinary medicine. My name is Susan Volk, and I have been a practicing veterinarian for the past 25 years. I currently specialize in small animal surgery, as well as run a research laboratory where we study ways to improve the body's ability to heal and fight cancer in order to help not only pets, but people too. As a professor at the University of Pennsylvania's School of Veterinary Medicine, I also teach future veterinarians. When I was a young girl, younger than you are now, I was captivated by a series of books by an English veterinarian, James Herriot. He described his adventures in practice in Yorkshire Dales, taking care of farm animals and the community's dogs and cats. His ability to work with animals and help people at the same time seemed like it was the perfect job for me. And more than 40 years later, I still believe that veterinary medicine was the perfect career for me. My career, however, is absolutely nothing like what was described in Mr. Herriot's book series. This operating room, seen on the right-hand side of the slide, looks similar to any modern OR you would find in a human hospital, and is where I spend much of my time caring for patients, highlighting just one of the incredible opportunities that exist for veterinarians today. I will talk more about such opportunities and more in my presentation. Even at a young age, I could identify with many of the things a veterinarian did in private practice, whether from books or taking our own pets to the vet. At the time, I could see myself spending my life doing them. Over the past 2 decades as a veterinarian, that job has changed both because of the way veterinarians practice, but also because of how I have adapted my own career to suit my strengths and my passion for the job and the people and pets that I serve. One of the most important parts about Career Day, I think, is to get to know what a particular career really is about, what skill sets and training are required, and what benefits and pleasures would that job offer you. To really feel that you have the dream job, it is important to consider all of these aspects before setting out to achieve your career goals. As the late great Steve Jobs, founder of Apple, said, "Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do." So to help you decide if veterinary medicine is what you might love to do, I'd like to talk about what a career in veterinary medicine means, as the job description of one veterinarian to another is much more diverse than most people realize. By example, I will talk about what I do and the path I took to get here. I'd also like to talk about the demographics of veterinarians. So what are some of the characteristics that currently describe veterinarians? When I talk about these, please don't see it as a barrier. If how the average veterinarian is defined today doesn't fit how you see yourself, but if everything else in the job fits you, don't let that stop you. The face of veterinary medicine is changing in incredible ways. Just as today, it looks nothing like it did in the books I read when I was a young girl. In addition, I will talk about what are the skill sets and education required, as well as some of the benefits of the job, to see if you think you would be a good fit for veterinary medicine, and if veterinary medicine would be a good fit for you. And if you think that it fits you, then I will provide suggestions for how to maximize your chances of becoming a veterinarian, which I still believe is the best job in the world. Most of us think of veterinarians as private practitioners in small animal, equine, food animal, or mixed animal practice. But these practitioners may see patients in a general practice on the front line of routine care, or in a specialty practice where you can see the many types of recognized veterinary specialists similar to those in human healthcare, such as surgeons, radiologists, internists, sports medicine specialists, anesthesiologists, ophthalmologists, dermatologists, and more. There are also veterinarians who practice within shelters to care for some of our most vulnerable patients, homeless pets. Veterinarians may also be employed in a corporate setting, performing research or marketing veterinary therapies or products. There is also a large population of veterinarians that work for our federal government at the U.S. Department of Agriculture, the Food and Drug Administration, or the Centers for Disease Control. In addition, veterinarians may also serve in our military to care for the many canine soldiers stationed throughout the world, as well as to participate in military-based research projects. Whether in the military, university, private practice, or industry setting, veterinarians play a key role in much of the research that is occurring across the globe. That research benefits not only animal health, but human health as well. In addition, veterinarians may have a primary job in teaching, or teaching may be a component of their job, just as it is in my job. Veterinarians may perform their jobs for the benefit of public health in the capacity of food supply medicine, global veterinary medicine to stabilize endangered species, or support the health of the earth and its people, as well as play critical roles in establishing public policy. One thing I absolutely love about my job is the ability to interact with many types of patients, mainly dogs and cats, such as some of these shown in these pictures, but I also have the pleasure of being able to care for many different species, such as birds and snakes and small mammals, such as sugar gliders. Each species is somewhat unique, and so even 25 years after graduating from veterinary school, I must continue to learn in order to be able to provide the best possible care for my patients. Thankfully, veterinarians are able to treat the majority of our patients with excellent outcomes. However, we, just like our physician counterparts, also have very challenging cases that we aren't able to achieve the successes that we were hoping for. Here are some of those types of challenging cases. Those pets that have sustained severe trauma, such as badly broken bones or extensive burns, have developed severe infections or aggressive cancer. In these patients, our existing therapies may not be enough to help us return these patients back to normal. It is important to realize that as a veterinarian, you cannot always help every patient and to be able to handle those stresses. But also, as veterinarians, we can be part of the solution too. So for these challenging cases, we need to rethink surgery. I began working at the veterinary school as an undergraduate doing research and caught the research bug, so to speak. I was incredibly fortunate that Penn Vet has its amazing VMD PhD program where you pursue veterinary and PhD degrees simultaneously and was accepted to that program. It became clear to me after the start of classes that clinical work would always be a part of what I did. And so I did a laboratory rotation with Dr. David Nunemaker, a pioneer in veterinary surgery, first in small animals and then as an equine surgeon. What fascinated me about Dr. Nunemaker was the fact that he was just as interested in his bone biology work and how to prevent horses from needing surgery as he was in developing innovative solutions once they did need surgery. And that for me was an eye-opener about how I wanted to practice veterinary medicine. I knew that I wanted to incorporate research into my career to help me bring new therapies that could allow me to accomplish what I occasionally couldn't do in the OR for those most challenging cases and provide even better care for my patients. For example, can we develop safer, less invasive therapies that would result in better outcomes with less pain than currently exist? So if we can identify better ways to treat dogs with severe arthritis more effectively through research, they may not need joint replacement surgery. Also, can we develop additional therapies that may help patients after surgery to help them heal better or to reduce recurrence of cancer, either at the site of the tumor was removed or in distant sites at a later time? So in addition to treating small animal patients in the clinics and the operating room, I also spend a large portion of my time running a research laboratory to improve our ability to help treat these tough cases. These studies involve understanding how cells behave in both normal and abnormal situations, such as when tissues or organs in the body fail to heal or heal with too much scar tissue, or in the case of developing cancers. You may have noticed that the problems that our pets have are also many of the same problems people have. And so as we learn more about diseases in animals and try to improve animal health, we can improve human health too. This also works in reverse, where we advance our knowledge in human health and then can apply this knowledge to our veterinary patients. This is a process referred to as the One Health Initiative, which is a collaborative approach that simultaneously improves the lives of people, animals, and their environment. To make the kind of difference it takes a team, and here's a picture of my team made up of students, both veterinary students and doctoral students, technicians, and researchers looking for additional training after receiving their PhDs. And together, we can make some really fun and cool discoveries and develop inventions. And here is a recent patent awarded for our work on improving care for breast cancer patients. So my point is that a career in veterinary medicine can open up tremendous opportunities that are both incredibly fulfilling and create a lot of job happiness. Okay, so backing off from the example of my individual experience of what this veterinarian looks like and taking the 10,000-foot view, who are veterinarians as a group? Compared to many professions, which are dominated by men, currently 2/3 of all veterinarians are women. If you advance the slide, you will see that this switch from a male-dominated profession happened in the mid-1980s. So now you can see that the age group younger than 50 is comprised mainly of females, seen here represented by the red line, whereas older veterinarians are more likely to be men. Unfortunately, the profession currently lacks racial and ethnic diversity. As you can see, the profession composition is primarily Caucasian. But as I mentioned earlier, do not let the current demographics dissuade those of you from minority populations from pursuing what you feel is the career for you, as these numbers are changing, and now, more than ever, there are opportunities for underrepresented minorities as we recognize how important it is that we must better reflect overall population demographics to be more effective as a profession and serve our patients and their owners. Veterinarians on average are fairly well compensated. As you can see, the average yearly salary is nearly twice that of the national average. And these numbers from a couple of years ago are pretty close with current values. As you might expect, starting salaries are slightly lower, but still above the national average. However, you must also consider that the average academic debt of a student just finishing veterinary school is nearly $150,000. Whether you think these numbers are high or low, I think keeping in mind what Jen Wilter, the National Hockey League's first female coach, said is important. If you want to be successful in this world, you have to follow your passion, not your paycheck. Another bit of good news is that there are tremendous job opportunities out there for veterinary practitioners. And the outlook looks great for the profession, with a job growth rate predicted above 18%, which is 2.5 times the national average. We can see in the graph on the left that the open positions, indicated by the blue line, far outweigh the number of applicants seeking those positions, represented by the green line, which means not only will jobs be available when you're looking for them, but also that it will be a buyer's market, meaning that you will be able to negotiate well in a competitive market. On the right, we see a map looking at the location quotient, which shows areas of the country, in the darker shades of red, where veterinarians have a higher share of employment when normalized for all occupations and people, and those states in the paler shades that have lower shares of veterinary professionals. There are currently 32 veterinary schools in the U.S. that have been accredited by the American Veterinary Medical Association. Our state school is at the University of Pennsylvania, where I graduated from and where I work now. There are also 5 Canadian and 16 veterinary schools outside of North America, which have been accredited by the AVMA. Notably, as a Pennsylvania resident, you are not restricted to go to Penn Vet. And in fact, 60% of our most recently accepted class at Penn Vet is made up of non-Pennsylvania U.S. residents and international students. Much more important than who the average veterinarian is today, how much they may earn, and where they can be educated, is whether the profession would be a good fit for you. Some of the skill sets that are important in veterinary medicine include having technical and scientific aptitude, having complex problem-solving skills, as well as quick decision-making skills, and an attention to detail. You also need to be an excellent and effective communicator, have compassion, have excellent time management skills, and be able to handle stresses of the job. You need to be dedicated and provide customer service skills, as well as have strong business acumen. So if those skills are those you possess or believe you can develop, you might be a good fit for veterinary medicine. But would veterinary medicine be a good fit for you? There are many great things about being a veterinarian, especially if you like to help animals. The profession provides interesting and varied work that engages many skill sets, so this career will not be as good for those who really like predictable work. As we talked about, it has a good salary, although not as high as that seen in human medicine, which uses similar skill sets and commands the same degree of education. Veterinarians do have a relatively high degree of professional independence, which may be of interest to some of you. For those who love learning new things, there is tremendous lifelong educational opportunities and requirements to continue to adapt and learn for the benefit of patients or to advance other professional goals for those veterinarians who work outside of direct patient care. Again, there are many different career options, as I mentioned earlier, not only being a veterinarian that cares for animal patients. We are also highly communicative professionals and develop rich relationships both within our professional community, but also with communities that we serve locally. So if at this point you are sold that this is the profession for you, what can you do starting now to optimize your chances of becoming a veterinarian? Start with getting good grades so that you can build your academic portfolio. Continue to be considered for honors classes and then do well in those classes because those typically accepted into veterinary school will have good grades and test scores. But don't let these good grades get in the way of spending time experiencing what veterinary medicine might be like and taking part in extracurricular activities, as these are important too. Many veterinary schools require you to have at least 500 or even 600 cumulative hours of experience at a veterinary practice, working with animals at a shelter or on a farm, for example, so that applicants really are sure that this is how they want to spend the rest of their lives. The admissions committees also really like well-rounded students that have been involved in extracurricular activities or have served their communities. In the next couple of years, begin to build your leadership skills in sports organizations or various clubs and activities that you may be a part of, and then continue those activities throughout college. Finally, you will need 3 letters of recommendation on average from people who can speak to your skill sets and personality that would make you a great veterinarian. A veterinarian you've worked with, a college professor, somebody who has employed you or coached you, for example. And thinking about who you would ask to write your letters, you will need to make sure they know you well enough to speak about these important aspects of your academic skills as well as your personality. Hopefully, you've learned new things about careers in veterinary medicine, whether this might be a good fit for you, and if so, some things that you can do, even starting now, to help you achieve your goal. This is the official end of the Career Day talk, but for those of you that want to test your developing veterinary skills, I have a couple fun slides for you. The first is, what happened to this nosy dog? It may give you a clue if I ask you who he ran into on his walk outside. If you advance the slide, you will see if you were correct. If you guessed that he got too close to a porcupine, you were right. Ouch! As you can imagine, these are very, very painful, and each of these quills must be carefully removed by a veterinarian to avoid long-term problems. Despite the dangers wild animals can pose to our pets, veterinarians also take care of wild animals as patients, and some of them, such as these baby porcupines, do make the cutest patients. Unfortunately, our pets eat many things that they should not, including this dog. As a veterinary surgeon, I often have to remove many things that our pets eat that they shouldn't. This is a real case. Can you guess what this dog swallowed? Think of something that might be covered with meat flavors that a dog would love. Advance the slide to see if you were right. Were you able to guess that this was a knife? If you'd like to see more crazy things people's pets have eaten, let's keep going and advance your slides. This one is perhaps a bit more obvious. The story from the owner was that she was eating a bowl of ice cream with her dog sitting next to her when she heard a knock on the door. When she came back from answering the door, the ice cream in the bowl, as well as the spoon she was eating it with, were both gone. When she looked everywhere but couldn't find the spoon, she brought the dog in for examination. Well, we found it. Now that you've practiced your veterinary radiology skills, here are a couple that are a bit more challenging. In this x-ray, the stomach is full of many objects. Can you guess what they may be? A clue is that on x-rays, air, which is not dense, shows up as black. And very dense structures, such as bones, show up white, while organs and fluid that have intermediate densities show up in grays. You can see that the objects are moving out of the stomach and into the small intestines in the area above the yellow arrow, which allows you to see individual shapes. Have you recognized the objects that this dog ate? This dog's owner had seen him eat rocks from the driveway, but he had no idea just how many the dog had eaten. Now that's a lot of rocks. This cat came to our emergency room for vomiting. Can you guess what his owner's favorite hobby is? The two objects marked by the yellow arrows will help you the most. Advance the slide to see if you were right. For those of you who guessed that this cat is owned by a fisherman, you are correct. This cat had a blockage of its intestines caused by eating fishing line with attached hook, sinker, and swivel. For those of you who enjoy building and fixing things, veterinary orthopedic surgery may just be the career for you. Here is a broken femur, the large bone in our thigh, here in a dog. Unfortunately, this is not a place that is easy to place and maintain a cast. And so these patients generally need surgery to stabilize the bone ends together until they have time to heal. Advance the slide to see how we fix this one. For those patients with severe bony and soft tissue injury, such as this cat that was shot by a neighbor while out in his yard, we may use devices called external skeletal fixators to stabilize the bones through connectors outside the body. For those of you who spent hours playing with erector sets or tinker toys to build fantastic and stable structures, your time may pay off here. Advance the slide to see the original fixation, which is strong enough to support this very unstable fracture. This fracture is initially so unstable because there are many small fragments. But as the fracture heals, the tissue becomes stronger, and we no longer need the fixator to bear quite as much of the weight, so we can begin to remove some of the components. Note that some of the connecting bars are not made of metal and therefore do not show up on the X-ray. You can see how we change the fixator over time to adapt to changes in healing, and a picture of Jerry, the patient, if you advance the slide. Jerry must wear a protective bandage over the fixator so that the fixator doesn't scratch him or get caught on anything in his surroundings. If you advance the slide again, you will see a picture of Jerry almost 20 years after he healed from his injuries. This case also reminds me to mention that many of these patients who touch us continue to stay in our lives long after we treated them, and this owner continued to stay in touch with me even after Jerry passed away at a very old age. For those of you who were just starting to get the hang of veterinary radiology and identifying foreign objects, please try to identify the animal shown here as well as the abnormality. To clue you into where you should be looking for this abnormality, please focus on the object that is highlighted by the red arrow. For those of you who recognize this as an iguana, you are correct. Although you certainly can't tell what color it is from the X-ray, this one is a green iguana, more specifically. And finally, if you happen to guess that this one was female and had one large egg retained inside of her, great job. We treat our reptile patients in many of the same ways that we treat our furry patients. Here is an iguana having its heart rate monitored before having a surgical procedure. Advanced imaging is also available to our patients, whether they have fur, scales, or feathers. Here is a CAT scan image of a bearded dragon. Advance the slide to see if you imagined what it looks like in real life. You did well if you guessed that this was a parrot. You may notice that because the feathers are not dense, they do not show up clearly on the X-rays, and you see just a hint of them towards the base of the quill. In real life, the feathers and particularly their colors make this scarlet macaw an absolutely stunning patient. Perhaps the ears and the long body gave this one away. Yes, it is a rabbit. Now that you are all likely pros in your ability to imagine what patients look like in real life based on the information you see in an X-ray, try to look at just a portion of this animal and determine what kind of patient belongs with these feet. Just like the last patient, this one is a great hopper, but you won't see him in your backyard. An important skill as a veterinarian in taking care of patients that do not speak for themselves is the ability to pay attention to all information that we receive. So if the clues helped you come to the conclusion that these feet belong to a kangaroo, great job. This particular patient came from the zoo and needed surgery many years ago for a dental problem that was causing her pain and prevented her from eating. It is important to look from many different angles when making a diagnosis and ruling out diseases in a patient. Remember, in X-rays, we must convert a two-dimensional image from several X-rays taken at different angles to a three-dimensional image in our minds. Looking at this single image, can you tell me what kind of animal this is? Would you pick this animal up? Seeing this patient from these views make it much more recognizable. Now do you know what this animal is? See how three views of the same object helps you imagine a 3D image in your mind better than if you were only provided with just one or two views? Probably many more of you were able to recognize this patient as a turtle with the additional views provided. Here is one of our red ear slider patients that needed to be anesthetized for surgery. And the last one to look at, as different angles of views are important in assessing a patient, so is our ability to look at the entire picture. Compared to the last patient, would you pick this one up? Maybe we shouldn't just look at the tail end of the X-ray to decide. You may or may not say yes after looking at the other end of the X-ray. If you recognize this as a snake, you were correct. Maybe some of you would only want to pick up a snake if it were anesthetized, such as this one. Even in companion animal veterinary practice, you can generally decide which type of patients you would like to see. Some practitioners see just dogs and cats, some only cats, while others may also see more exotic species. Not everyone sees exotic patients, such as this, but I find it a challenge and fun to be able to routinely care for patients that are so different, and this is part of what makes my job so wonderful to me. Hopefully, this talk has helped you learn about different careers in veterinary medicine. What are important skill sets to have in this profession? How to prepare, even starting now, for a career in veterinary medicine? And whether veterinary medicine is right for you. In addition, I hope you had some fun at the end. If you still have questions that this talk didn't answer, your guidance counselor can help direct your questions to me.